It's hard to imagine people fighting over each other to get to the dentist, but that's exactly what happened on our mission to Nicaragua this January. For many years, the Peace and Hope Trust has been sending a volunteer dental team from the UK to set up surgery in remote and marginalised communities in Nicaragua. For many villages, this is the only access many have to dental care, and when it only comes once a year, the chance to relieve acute pain is eagerly grasped by many people. In one location, the police had to be called to sort out a minor riot over queue jumping. After a couple of days operating in Bluefields, the team packed up all the equipment needed for a week working upriver. Food, drinking water, dental kit, and personal bags were all loaded onto the boat to take to their base in La Barra via the coastal village of Taspaponi. The team were delighted to be joined by Jose Manuel Ordonal, a dentist from Bluefields Hospital, who wondered what we did, and he offered to help us. Volunteering was something he had never done before. He soon learnt, and at Taspaponi Clinic, like the whole team, he worked from 8 a.m. to 8 p.m. No patient was left unseen, and the well-earned lobster dinner was enjoyed by candlelight and head torch. From the forward base at La Barra, the team travelled each day to nearby villages by panga to carry out surgeries in communities where many had never seen a dentist before. The first, Walpa, was a lovely little village but treacherous. To get back onto the boat at the end of the day, the team had to pick their way along a muddy track, carrying their equipment and negotiating a concrete jetty which had cracked and most of it had sunk. Miss Layla, a local nurse, had to crawl on her hands and knees along the broken edge of the jetty to get back onto the boat. At another of these villages, Karawala, the need was overwhelming. The team went back for an extra morning to cope with the demand for treatment, and still were disappointed to go home leaving some people in pain. They simply couldn't physically deal with everyone. The team had a total of 8 exhausting but rewarding days, and used up the entire stock of anaesthetic. They worked non-stop from dawn to dusk, and treated a total of 546 patients in just 8 working days, pulling 756 teeth, and even doing oral surgery where required. A job well done, but this beautiful, if desperate part of the world will be needing visits from volunteer dentists for many a year to come.